Alright, I'm going to do some hand hygiene. Hello, Mr. Kennedy. My name is Jamie Kennedy, and I'm going to be your nurse practitioner for today. I'm just going to be doing a quick assessment over you, just taking a listen to your heart, your lungs, taking a look at your eyes, ears, nose, and throat as well. Are you comfortable right now?
Yep.
Alrighty, awesome. If at any point during the assessment, if you are uncomfortable, please just make sure to let me know, okay?
Okay.
Alrighty. So I'm going to go ahead and start off with just taking a look at your nose, making sure it's symmetrical. I don't see any deviations. I'm going to go ahead and palpate your sinuses. Alrighty. Now I'm going to go ahead and take a look in your nose. So if you could lean your head back, I'm going to put a little light in there. Alrighty. Turbinates are pink, no edema. Alrighty, no drainage. Great. Now I'm going to go ahead and take a look at your ears. Just feeling around them. Is there any pain?
No.
Okay, good. Now I'm going to go ahead and take a look inside your ears. And I see the tympanic membrane. It's pearly gray. Structures are intact. Alrighty, going to come around to this side. And I'm going to take a look in this side as well. Alrighty, I see the tympanic membrane. It's pearly gray, structures are intact. Now while I'm on this side, I'm just going to go ahead and test some hearing on you. I'm going to have you put your finger on that other ear, the opposite ear, and wiggle your finger around. I'm going to whisper some things to you and try to repeat them back, okay?
5, 4, 2.
Okay, very good, Mr. Kennedy. Alrighty, now can you do it on the same or this ear?
9, 8, 4.
Okay, awesome. And if I was in the office setting, I would go ahead and do my Weber test. So I would take my tuning fork, I would hit it, and I'm going to put it on the top of your head. And do you feel it to one side or the other more? No, it's even? Okay. Awesome. Now I'm going to go ahead and do the Renee test on you. So I'm going to go ahead and tap my tuning fork. I'm going to go ahead and put it on the back of your ear. Let me know when you can't hear it anymore. Okay, can you hear it now? Okay, tell me when you can't hear it anymore. Okay. I'm going to slide to this other side. And I'm going to do the same thing. I'm going to hit my tuning fork. Let me know if you can feel it. Alrighty, let me know when you can't hear it anymore. Okay, now can you hear it now?
Yep.
Okay, let me know when you can't hear it anymore. Okay, great. Now I'm going to go ahead and take a look inside your mouth. I'm going to have you open nice and wide for me and say ah. So I'm looking at his posterior throat. There's some slight redness going on. Can you lift your tongue up for me? Okay, looks great. There's no lesions inside the mouth. And I'm also just inspecting the outer lips. There's no lesions, no breakdown or discoloration. Okay, so now we've done your eye, we've done your nose, your ears, and your mouth. I'm going to go ahead and feel your lymph nodes. Let me know if you feel any tenderness at any of these points. Can I get you to lean forward like this for me? Alrighty, so no lymph nodes are palpable, that's great. And I'm also just taking a look at his neck now, making sure that his trachea is midline. I don't see any sort of deviation. So I'm going to go ahead and palpate his thyroid. So I'm going to feel your thyroid, Mr. Kennedy. First I'm just feeling around, feeling if I feel any enlargements. I'm going to be palpating the isthmus and the lobes. Alrighty, fantastic. Now I'm going to come around to the front side and I'm going to check out your carotids. I'm going to just feel your carotid pulse here, making sure just to do one side at a time. Okay, good regular pulse. Now I'm going to just go ahead and take a listen with the bell of my stethoscope, listening for any breweries at your carotids. Alrighty. No breweries present. That's fantastic. And while I'm also here, I'm just gonna, if I had him in the office, I would have him lay back at a 45-degree angle looking for any jugular venous distension. So just slightly recline a little bit for me. And what I would be is I would be looking for it over here. Okay. So now we're going to go ahead and we're going to do your eyes. I'm going to just be looking at the outside of the eyes, looking for any abnormalities, looking underneath. Looks fantastic. Alrighty, I'm going to shine a little light in your eye. I'm going to be checking your pupils. So I'm going to check this side first. Alrighty, so people went from about a 3 to a 1. Now I'm going to check my consensual on this eye. And again, went from about a 3 to 1 and it dilated. Now you're going to get a little light in this eye. Okay, pupil dilated from about a 3 to 1. And now I'm going to look in the opposite eye. Okay, fantastic. It was consensual as well. Now I'm going to just have you follow your eyes with just my pen. Okay, fantastic. Now I'm going to have you look over my shoulder here. Now look at my pen and follow it in. Alright, eyes accommodate for me. Now I'm going to go ahead and test your peripheral vision first, actually. So I'm going to have you cover this eye, cover the same eye as me. Alright, now tell me when you can see my fingers.
Yes, 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 yes.
Okay.
Yes, yes, yes.
Okay, now can we cover the other eye?
Yes, 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 yes.
Okay.
Yes, yes, yes.
Okay, awesome. Now I'm going to have you go ahead and we're going to check your vision on this chart. It's a Rosenbaum chart. Can you read the smallest line possible? Go ahead and cover one eye.
4, 2, 6, 7, 3, 9.
Alrighty, that's fantastic. Now go ahead and cover the other eye. Alright, and now I'm actually going to have you read the E's and the W's. So you can you tell me the smallest line that you can read?
E, W, M.
Okay, fantastic. Now, this may be a little uncomfortable, but I'll try to make it as comfortable as I can. I'm going to be checking your macula and retina. So I'm going to go ahead and shine this light in your eye. Okay, looks great. I'm going to come around and do this eye. Okay, looks great. Okay, now that we've done all those, I'm going to go ahead and ask you to go ahead and take off your shirt for me so I can take a look at your chest for your heart and your lungs. And I'll go ahead and take your shirt and put it right here for you. Alrighty, so now I'm going to start with the lungs. I'm just looking for any sort of respiratory distress, watching the symmetry of his chest, making sure it's rising and falling. For vision purposes, I'll go ahead and start with the front and then we'll move to the back. So I'm just going to palpate. Let me know if any of this hurts for you. Any pain? Okay. So I'm going to go ahead and take a listen to your lungs. I'm going to have you take deep breaths in and out through your mouth, okay? Lower here, I'm going to go ahead and listen to your lateral lungs. Still doing okay? Okay. Now for the camera, do you mind turning around so we can see your back? So just flipping around there. Alright, and again, I'm just going to be checking for symmetry. I'm going to go ahead, I don't see any abnormalities. I'm going to have you take a deep breath in. Okay, one more. I'm just looking for symmetrical rise in my hands. Alright, now I'm going to go ahead and palpate the lung fields. Okay. Feeling at the intercostal spaces. Okay. Well, in those same lung areas, I'm going to go ahead and listen to your lungs now. Go ahead and take a deep breath in. Okay. Okay, sounds great. Now, do you mind turning back around for me? All right, and at this point, if you don't mind just laying down for a second, I'm going to go ahead and feel your point of maximal impulse. All right. The rate is regular. Don't feel any abnormalities. Okay. Now I can go ahead, if you don't mind sitting back up for me real quick. Okay, now I'm going to go ahead and I'm just looking at, again, the heart area, palpating. There's no pain anywhere, is there? Okay, now I'm going to go ahead and take a listen to your heart sounds. I'm going to first start with the diaphragm on my stethoscope. Okay, and I'm going to flip around, take another listen. Alrighty, Mr. Kennedy, I'm all done with checking your heart and lungs, so you can go ahead and put your shirt back on. In regards to pulses, I did already go ahead and check your carotid pulses. Those were symmetrical, no abnormalities present, regular rhythm. Went ahead and checked for our jugular venous distension. Now I'm going to go ahead and feel your radial pulses here. Okay, now I'm going to feel your brachial. Okay, and then I would go ahead and feel my femoral, and while I'm feeling the femorals, I would also obviously be doing it under his clothes and the gown, but feeling right about here. And I'm also going to go ahead and feel for the lymph nodes there, the inguinal lymph nodes. Is there any way I could get you to slide and put those feet up there so I can take a look at your feet as well? Alrighty, and I'm examining the legs, looking at the hair, is it evenly distributed, making sure there's no cyanosis or pallor down here. There's no edema present, checking for the edema. I'm going to go ahead and feel your popliteal pulses. Alrighty. Then I'm going to come around and feel the posterior tibials. Okay. I'm going to feel the dorsalis pedis pulses. Alrighty, everything looks great, Mr. Kennedy. Is there anything else that I can do for you today?
No, ma'am.
Alrighty, thank you very much.